All right, I'm going to share a protocol for hemorrhoids, which we don't want to think about, but if it happens, you'll be glad that you have this. So we're going to start with 2 points on the governing vessel channel. That's the channel that goes from the upper lip all the way down to the tailbone. And we're actually going to start on the tailbone. So you know how the tailbone hooks like this? It's actually right there. So you feel the very tip of the tailbone, and then off you feel the soft spot. And it's before you hit any private areas. Although I don't know that I would do this in clinic, but for yourself, this is a great point for hemorrhoids. So you just reach back, feel the tip of the coccyx, fall off of it into the soft area, and then just do a little massage. And this is called long and strong. And I don't know if that's why they named it, but it also treats erectile dysfunction, long and strong. And then the other point on governing vessel is the very tippy top. This is one we use a lot because it's the pull yourself together point. So very tippy top, the highest point of the skull. It's called 100 meetings. It's pulling everybody together. And for when the bottom is dropping out, like prolapse, uterine prolapse, rectal prolapse, or hemorrhoids, we're hanging low. This is a great point. And then the next point is on the back of the calf, where this muscle comes up and forms like the two heads. You can kind of see the indent between those two muscle bellies. That is bladder 57 in between, right below the calf muscle, and we can do both sides. This is called support the mountain or support mountain. And so we might think of a hemorrhoid as an unwanted mountain, but it also has a lot to do with physical strength and like you'd think of with a mountain. Very sturdy. And then this point is sort of the hemorrhoid point. It's indication like this is great for back pain and knee trauma. This is pretty much used for hemorrhoids. You get a hemorrhoid, have hemorrhoids. It is 5 finger widths, including the thumb there, so it's right there. And there's 2 tendons you can feel, and it's the thumb side tendon. And you there's a point on both sides of it. So it's 5 fingers up, both sides of that tendon. Do the left side first. And I have personal experience with this one. Never had a hemorrhoid until I turned 40, but I did have the experience, and I can vouch for these points. Very quick relief in my experience. You know, everybody's different. And of course, if you have chronic hemorrhoids, if it happens all the time, we have a medicine called Vessel Care. 5 finger widths up, both sides of that tendon. Just pinch it in. Legal massage. Our Vessel Care medicine is indicated for varicose veins, hemorrhoids, or circulatory problems. There's something called intermittent claudication, where you have pains in your legs because of lack of circulation, pain when you walk, and it's good for that. In fact, in Europe, I've heard that ginkgo which is in Vessel Care, is a really largely prescribed medication for intermittent claudication, like in the medical system. And that's it. Do that a couple times a day if you're having a problem, and I bet you will have relief within 1 to 2 days, maybe 3. Thank you.